So this is Dr. John Harper, and I'm here with Alice Peneku. And she came to us. She had some issues with tingling in both hands and burning in both feet. Also, she had sciatic neuropathy from her low back down her left leg, and this was interfering with her life. And so, tell me a little bit about how these things were interfering with you, and how you weren't enjoying life as much as possible.
Well, I love walking, and I dance hula, and interrupted my dancing. I mean, I could dance, but after doing just one number, I would start hurting, and then that would go on for a week or two sometimes, and again, it was nothing. There was nothing the doctor could do except give me some medicine for pain and topical cream to put on my, the burning part or the parts that were hurting.
Okay. So so when you would take the medication or use the topical cream, didn't fix it, right? It was just a temporary relief at best, and then
Exactly.
that. Okay, all right.
Exactly.
And then you came to us, and you've been here for a little more than 2 months. And tell us how you're doing now.
I am doing great. I think I tell you that, my medical doctor had advised me to have surgery or take shots
Right.
for the pain.
Right.
And I refused only because I just don't like needles for one, but I just thought, that's just temporary too.
Right.
And I wanted something that was permanent. And one of my friends told me about you. And she says, you need to check him out and see what he has to offer. And when I came here and you started your treatments, I would say the very first week that I was here took away the burning sensation, which I was so happy.
Fantastic. That's great. Very good. Yeah, I wasn't aware it was that fast. Good. I'm glad you told me that. That's great.
Yes.
And so now these things have improved dramatically. How has your life changed? What things are you doing, and what are you looking forward to?
Well, I'm doing more hula.
Yeah, fantastic. You're dancing again.
Yes, I am.
Fantastic, because you love that.
Yes.
That's part of your
Yes,
heritage,
it's
and
part of my heritage.
Right.
And I'm just looking forward to going home and enjoying what I have, or what I have accomplished with you, with the treatments that you have given me, going home and being with my family.
Fantastic.
And doing, the hula with them.
Wonderful. Yeah, I enjoy helping people feel better, but it's the stories of what they get to do now. Now that their pain and their disability is gone, now that they're not afraid to use their bodies again, you're going to take this month-long trip back home to Hawaii, and you're going to climb Diamond Head, and you're probably going to be the healthiest one back there, and that's great.
That sounds like that's it. I told my sister, my youngest sister, what I was doing, and she goes, I need to get back in shape. I says, yes.
Good.
And I said, when I'm there, I'm going to be staying with you, and I'm going to be sharing some of my things with you.
Perfect. Yeah, yeah. You never know how far people you'll be influenced by the things that we say and do.
Yes.
So fantastic. Well, I just want to ask you one last question. One of the reasons why we're doing this video is to let other people know that we can help people, and we do have skeptical people that come in here. And like you had mentioned to me before, you were one of those skeptical people, but you decided that being happy and healthy was and giving it a chance was more important than just continuing to suffer. And when people are skeptical, they're usually skeptical about results, and we already know that you've had good results in a short amount of time. But they're also worried that we're not going to be straightforward or treat them right, or not be honest about financial obligations or time obligations. What would you say to somebody that has that kind of skepticism?
I say, you know what, if you've been suffering with the pain that you've been going through for a long time, try it. And I promise you that you would be amazed on how you'll feel. And also having Dr. Harper, and he's straightforward, and also his staff They're wonderful people.
Great people, huh?
Yes.
Yeah, yeah. I wouldn't work with anybody else, that's for sure. You good patients deserve the best, and that's what we try to do. So very good. Well, hey, thank you, Alice, very much. I appreciate you taking this time, and I sure wish you a wonderful day today.
Thank you.